What's good, YouTube? It's Jay, and I'm back again with another video. I'd like to welcome you to Respiratory Therapy Essential for the TMC exam. Tonight, we're talking about one of the biggest subjects in respiratory therapy, and that is ARDS. And without any further ado, let's do this. For the TMC exam, ARDS is by far one of the most critical topics that you would have to deal with on the exam. Again, I'll be working on the board from Roman number 1 to Roman number 3 from left to right. ARDS is an acute illness or injury involving the lungs. And this will result in reduced lung compliance, diffuse or diffuse atelectasis, refractory hypoxemia. Some of the causes of ARDS are listed also here on the board: sepsis, aspiration, pneumonia, severe trauma, massive blood transfusion, and of course, drug abuse or drug overdose. Now, there are some things when you are assessing and when you are treating these patients that you should look for in the ARDS patient. And we'll go to Roman number 2. Those things are listed, which is cyanosis from refractory hypoxemia, pacnia, substernal or intercostal retractions. You will find bronchial breath sounds or crackles. Chest percussion will reveal a flat or a dull note. These patients would have tachycardia and hypertension. I can't stress enough how important this information is that I have on the board tonight, because you will see all of this in some form on the TMC exam. You have to know this like the back of your hand. Now, when you do diagnostic testing on these patients, you will find a lot of things, especially when it comes to chest x-rays, because the chest x-ray or imaging, they may call it on the TMC exam. You know, we're getting away from saying x-ray. But the chest x-ray or the imaging of the chest will show increased opacity, diffuse infiltrates, and without a doubt, if you see honeycomb, ground glass, or reticular granular type of words on the chest x-ray, there is no doubt and should be no doubt in your mind that this patient is diagnosed with ARDS. Arterial blood gas will show refractory hypoxemia. Alveolar hyperinflation also with hypoxemia. Pulmonary function test will show decreased volume and capacity. Now, these would be the vital capacity, the residual volume, the FRC, and the TLC. All reduced volume and capacity in your ARDS patient. Hemodynamically, you will see an increase in the PAP or pulmonary artery pressure, but the PCWP, pulmonary capillary wedge pressure, will be normal. So elevated PAP, and you will see a normal PCWP. For the treatment and management of ARD patient, the number one thing you have to do is treat the underlying cause, whether that's aspiration, whether it's a drug overdose, or whether it's pneumonia, or whether it's a massive blood transfusion, or whether it's severe trauma. Those are underlying causes that you will have to treat or manage. Number one, the patient will need oxygen. Of course, another one of the main problems is trying to keep them oxygenated. You can do that by using CPAP and PEEP. And on the TMC exam, The NBRC will take you where no man have taken you before when it comes to PEEP. If you think 10 of PEEP is the highest that you are going to see on the exam, you are so wrong. They will take you higher, and don't be afraid on the exam, because on the exam, you are the physician, you are the lab tech, you are the doctor, you are a radiologist, you are everybody on the TMC exam. All right. Now, if the patient is on the ventilator, and that goes without saying, because most of these patients will be on the ventilator, they will have decrease in tidal volume. Now, remember, on the TMC exam, the tidal volume will be lower than 6 to 8 milliliters a kilogram predicted body weight. Whereas we must follow the Ards protocol when we are dealing with Ards patient, which means that their tidal volume sometimes may be as low as 4 milliliters a kilogram predicted body weight. Remember, the NBRC on the exam want you to follow the Ards protocol, so make sure you study it and know what it is and know how to apply it. Plateau pressure should be less than 30 centimeters of water pressure. Plateau pressure should be kept less than 30 centimeters of water pressure. Lung recruitment maneuvers, which simply means high PEEP or more PEEP than you are used to, you and I are used to, okay? But you will have to do some lung recruitment on the TMC exam, and if it calls for an increase in PEEP for a certain amount of time continuously, do not shy away. Give them the PEEP that they need in order to help the oxygenation problem, okay? And when all others have failed, then you know that we go to ECMO, all right? Including, if all has failed, then there are some other modes of mechanical ventilation that we may use. IRV being one of the ones that you may see, and APRV, PRVC, and HFV. All of these you could see on the TMC exam as a mode of ventilation for severe cases of ARDS. Now, we also allow for some permissive hypercapnia in these patients. And don't forget that you will see on the exam. Now, in closing, I want you to remember that if the PF ratio, the PaO2, FiO2 ratio is less than 300, then this is actually diagnosed as an acute lung injury. But when the PF ratio is less than 200, now you know that you are dealing with ARDS, adult respiratory distress syndrome. This is what we are talking about tonight. Okay, guys, there you have it. Screenshot that board, because everything that's on this board you will be confronted with on the TMC exam. There you have it. ARDS for the TMC exam. Study hard, guys. Make sure you remember these tips for the TMC exam. Do me a favor, hit that like button, subscribe to my channel, turn on the notification bell, because I'm giving you a video for the TMC exam every single week. And until next time,